Jean-Martin Charcot, a 19th century French scientist, worked with treating patients with hysteria by hypnotizing them. Much of Charcot's ideas and procedures stemmed from Franz Mesmer, who started the treatment of hypnosis and hypnotherapy. He believed that hysteria was the result of a weak neurological system which was hereditary. Charcot believed that a hypnotized state was very similar to a bout of hysteria, and so he hypnotized his patients in order to induce and study their symptoms. Charcot also taught Sigmund Freud, which could possibly relate to Freud's psychoanalytic theory. In 1935, Portuguese neurologist Antonio Egas Moniz performed a brain operation in a Lisbon hospital. This was the first ever modern lobotomy to treat mental illness, which involved drilling holes in his patients' skulls to access the brain. The idea that mental health could be improved by psychosurgery originated from Swiss neurologist Gottlieb Burckhardt. He operated on 6 patients with schizophrenia and reported a 50% success rate, meaning the patients appeared to calm down. In 1936, psychiatrist Walter Freeman and another neurosurgeon performed the first U.S. prefrontal lobotomy on a Kansas housewife. Freeman believed that an overload of emotions led to mental illness and that cutting certain nerves in the brain could eliminate excess emotion and stabilize a personality.
He was an idealistic doctor, hungry for fame, who would champion one of the century's most infamous medical procedures.
He wanted to solve the problems of psychiatry, and he wanted to do it fast.
The lesson here is not how a man can go off the rails, but is how science can go off the rails.
Ellen Ionesco was the first patient to undergo a procedure Dr. Freeman had perfected only weeks before. He called it transorbital lobotomy.
In a transorbital lobotomy, Freeman would first have the patient rendered unconscious through the use of the electroconvulsive shock machine.
Just before he threw the switch, we all had a laying on of hands and went for a little ride.
Usually 3 successive convulsions are necessary, but in old people a single one may be sufficient, while in a sturdy young person 4 or even 6 convulsions may be administered without danger.
The patient would then enter unconsciousness for a relatively brief period, but several minutes.
Now that the convulsion has subsided, the nurse holds a towel over the nose and mouth of the patient.
Freeman would peel back each eyelid, insert his ice pick, and with a hammer, tap through the brain, wiggle it about, sever the frontal lobes, withdraw it. And when the patient came to, he or she would be given dark glasses to hide the black eyes they'd been given.
In 1967, Freeman performed his last lobotomy before being banned from operating because his last patient developed a brain hemorrhage and passed away. The U.S. performed more lobotomies than any other country. Sources vary on the exact number, but it's between 40,000 and 50,000. Ladislas Joseph von Meduna experimented with shock therapy and schizophrenia in Budapest, Hungary during 1933. Instead of insulin, Meduna injected patients with metrazole, a less toxic synthetic preparation of camphor. This treatment was soon abandoned as it possessed a period of unpredictable length between injection and convulsions, giving the patient just enough time to become fearful and uncooperative. It also often produced convulsions that were so severe as to cause fractures. In 1938, Italian physicians Ugo Cerletti and Lucio Bini administered the first shock therapy using electricity. After conducting the experiment on a schizophrenic patient, they realized it was more successful in treating patients with depression. The treatment became widespread and was used most often in America and Europe. There is some history of abuse associated with this method of treatment that took place in mental institutions. Even though its creation was meant to treat patients, electroshock therapy began being used to intimidate, control, and punish patients. Many of these patients were subjected to the treatment over 100 times.
Okay, this won't hurt, and it'll be over in just a moment.
Uh-huh. What's that?
Conductant.
A little dab will do you. Right, Mr. Jackson?
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well?
Now just bite down on it.
Oh.
That's right. Just bite down.
Huh?
Now bite down on it.
Good.
Are you ready?
Here we go.
it.